and 1, and 2, and 1, and 2, and 1 more go, and another time. Okay, I guess this looks a little weird to you. A bit like physical therapy maybe, right? This, or something similar, is what most people imagine when they think of rehabilitation, or rehab for short. Middle-aged or even older people who, with varying levels of motivation, are bouncing around on exercise balls, to get back on their feet. Of course, that exists too. But the rehab we're talking about now has about as much to do with that as apples and oranges. So, in the next few minutes, let's clear up that cliché, shall we? Rehab, that's just for old people with hip problems or something like that? Because rehabilitation after a cancer therapy is different. And what exactly makes it so different and special is what we're going to clarify together now. Maybe when you think of rehab, you also think, well, wait a minute, couldn't we all just easily, go on vacation somewhere sunny? That's nice too. True, but a vacation is a vacation. It's there for rest and relaxation. Although a rehab also has something to do with relaxation, it's primarily designed to make you feel much better in the long term. Through professional support and not least by meeting other families who have had similar experiences to yours. And the good thing is they know what that feels like, without you having to explain much. So, that's also an important part of the therapy and helps you process what you've been through and find new courage. What's most important to understand first is that rehab is an integral part of cancer treatment. So it's just as much a part of it as everything else. That's why it's also medically justified by the doctors, because it helps you or your child to recover from the strenuous treatments, to process the experience, and to slowly find your way back into everyday life. It's not something you can just quickly squeeze in between other things, Meaning you should consciously make time and space for it, and really take advantage of this opportunity. The staff from the psychosocial team will advise you on specialized rehab clinics. And they can also help you submit the application for rehab to your health or pension insurance provider, so you don't have to be afraid of all the paperwork. You'll have absolute pros by your side. They'll also discuss with you which concept is the best fit. You see, there are 3 different types of rehab, so there's something for everyone. You're probably wondering what these are. So okay, now let's go through the different concepts. First of all, there's family-oriented rehab. So let's see, father, mother, child. There we go, there they are. Big family. All right now. So, the focus here isn't just on the child who is the patient, but on the entire family. You see? So in our case, that means mom, dad, and the siblings, right? Because everyone, in their own way, has had to carry the burden of the illness and has had to make a lot of sacrifices. The little ones and the grown-ups. That's why, in family rehab, there are separate therapy and leisure activities for each family member to address their individual needs. The activities take place in small groups or individually. And each clinic also has a few highlights in its program, like therapeutic horseback riding or climbing in a high ropes course. And of course, there will also be plenty of activities for you as a whole family, like group trips or cooking nights. The same applies, by the way, to the second concept, rehab for adolescents and young adults. As the name suggests, this concept is specifically designed for adolescents and young adults. The exact age range can vary a bit depending on the clinic, but it's usually somewhere between 15 and 25 years old. So let's say that would be more like these 3 here, right? Unlike family rehab, the stay at the clinic takes place without parents, yes, and without siblings. So if we say, for example, after the whole clinic stay, he or she can go there. And this is specifically designed for teenagers and young adults. This is where you have the special opportunity to meet peers, other adolescents, and to talk with them. And you will realize that there are other young people who have gone through similar things. The program is specially tailored to topics that are important in the lives of young people. For example, getting physically fit and resilient again, but also school and training, or things like becoming independent, separating from your parents. That's all part of it. And often, lasting contacts or friendships are formed in the group. And then there's a third concept, neurological rehab. This deals specifically with neurological symptoms, for example, during or after the treatment of brain tumors. The therapy programs are tailored to the patient. Depending on the age, a family member can also come along as a companion. So that could look like this, or maybe like this combination. We put those here. The neuro rehab takes place independently, so in addition to the normal oncological rehab. The focus here is on improving the neurological functions that have been impaired by the illness or by the therapy. This can, for instance, deal with the improvement of motoric skills or mobility, speech, or even mental abilities like memory or concentration. And by the way, for all teenagers or children in all different rehab facilities, there's a clinic school so that you can also keep up with your schoolwork. Yes, we've also made a separate video about that. So as you can see, rehab is a place where everyone has their spot. And it's not just about wildly hopping around on exercise balls, but a lot is done to meet you on all levels and to strengthen you, yes, physically, psychologically, and socially, so that hopefully when you're back home, you'll be perfectly prepared for a fresh start.